In the USA, adults will suffer from BDD at about a 2.5% rate. Usually 2.5% in females and 2.2% in males. So we know that out of 100 people, right, 2.5 or 2 or 3 women, because we can't have a half of a female, but 2 or 3 women will have BDD to the extent that it reaches clinical threshold.
Welcome back. We're your hosts, Savannah
and Kaylin.
Now, speaking of societal beauty standards and trying to fit into that mold and being so concerned about what other people are thinking of you, I wanted to talk a little bit about body dysmorphia. Because, to me, that's kind of in the same realm. So could you please give us an overview of body dysmorphic disorder?
Yeah, so BDD, as we call it, body dysmorphic disorder, is, again, as a clinical psychologist, we use these diagnoses to provide an understanding of what that subjectively felt experience of the person may be, right? So it's kind of like saying Italian spices versus Mexican spices versus Indian spices, right? Like we know the oregano and maybe the paprika would belong in the Italian and what have you. Same thing for labels here in the mental health world. We know that BDD is a very serious condition that affects a lot of folks. There's a specific code for it as well in the DSM. It's 300.7. And there's specific quote unquote diagnostic criteria, right, that are involved. Now,
when I think DSM?
The Diagnostic and Statistics Manual for Mental Health Disorders. Yeah, and you may need to double check that for me, but I'm pretty
I trust you.
Yeah, so it's very much again, I want to normalize the experience because it comes from a very complex constellation of factors. Right? From society, from internal, from self-esteem, from parents, but it really involves a preoccupation with a perceived defect or a flaw in physical appearance that a lot of times is not observable to other people, or it's not in sight.
Yeah.
Right. So when we think of kind of like being somewhat more preoccupied with flaws, right? We're thinking of specific things, right? So maybe somebody kind of thinks of, like maybe my hair is not the right way, or maybe I have a pimple on my nose and people are looking at it, right? And so the primary occupation is with the appearance, right? And the appearance causes that kind of intense, maybe time-consuming preoccupation. So these flaws are really not noticeable. And again, I use flaws because we're all human, right? Like I have a scar on my cheek, I have freckles on my nose, one eyebrow is maybe lower or higher than the other, right? We're human, right? So we're not going to be this perfectly put together, super symmetrical thing. Our bodies are 3 trillion cells, and we are going to go through all these different hormonal changes that are going to contribute to things. So individuals with body dysmorphic disorder are preoccupied with their physical appearance or certain flaws. They may believe that perhaps they look quote unquote ugly or unattractive or abnormal or deformed in some ways. And these flaws are not observable to others. And even if they were, they have a very different relationship with them, right? They make it very consuming, very distressing for themselves. So concerns can range from being, I'm not attractive, or I'm looking hideous, or perhaps I look like a monster, what have you. And those preoccupations can really focus on various parts of the body, mostly the skin. They can be focused on acne or scars or lines or wrinkles or different things like the hair, whether it's like the thinning of the hair or the excessive hair. Sometimes, a lot of times it's the face, the mouth, or the nose, or the eyes, for instance. But any body area can be a focus of concern. It's the teeth, or, again,
whatever. Yeah. It could be anything.
Chin, the eyebrows, right? The whole body, right?
Right.
And so some people really are concerned about asymmetry. and
Yeah.
their thoughts are very intrusive and unwanted and very time consuming. And so it's quite common actually for folks with BDD to consume hours, if not hours on end throughout the day to kind of be preoccupied with it. And they usually have a really hard time resisting or controlling that urge to check. So that's one of the criterias.
So it's basically, sorry, I didn't mean to interrupt you.
No, you're
Basically
good.
this all-consuming obsession with your physical appearance, nitpicking these flaws that you said are perceived flaws. Other people might not notice them, but to someone who has BDD, that's all they see on themselves.
Yeah. So there's the appearance component, as you said, and there's also the compulsive behavior. Right. So now we're going to sprinkle in some excessive repetitive behaviors or some mental acts like comparing, or sometimes we do like a preoccupation which is kind of like a preoccupation or a compulsion. Right. So think of like obsessive compulsive disorder. Obsessive meaning the acts, the rituals, the compulsions are the acts and the rituals. The obsessions are the thoughts, right? Yeah. Here in BDD, we have compulsive behaviors as well, where now people may feel driven to perform these behaviors, which increase anxiety and dysphoria, right? And they're typically really time consuming, and they have a really hard time resisting the ability to kind of control that. So it can be repeatedly checking the defect or the flaw in the mirror, whether it's like combing your hair, shaving, plucking, pulling your hair. It can be camouflaging something with applying makeup excessively to make sure it's not, perceivable to other people. It could be touching a certain area that they dislike and kind of, I don't know, having a dialogue with the area, like a stomach saying like, oh, like I want to get this out or what have you. Yeah. It can be anything really. And that preoccupation does cause some impairment, which is kind of the word that we use in psychology to say, hey, it's significantly distressing, right? It's causing some impairment in their functioning, whether it's their social functioning, maybe it's preventing them from going out with friends or family. Maybe it's occupational, it's preventing them from presenting themselves to work, right? If they don't have their makeup on, they can't go to work, or other areas of important functioning.
Right.
Yeah.
What are some ways that someone can recover from BDD in a sense, by basically stop obsessing over their body and their perceived flaws?
Yeah. So before I get to that, I want to point out that it's really important to know that there's different degrees of BDD. So, we have specifiers where we say a person has good or fair insight. And that means that the individual really kind of recognizes that the body dysmorphic disorder, like the beliefs with that, are definitely not true, or that they're definitely not true, or they may or may not be true. Right. So like there's a sense of like, oh, like I think my pimple is really like distressing, but I know that I'm probably wrong on this. I'm probably exaggerating it, right? That's with good or fair insight.
Right.
There's also something called we call with poor insight, right? Where now the individual thinks that the body dysmorphic disorder beliefs are probably true, right? Where now the pimple is really distressing and there's nothing that they can do and it's kind of the end of the world. So really important to differentiate that there's different levels, there's different extents. It's just like if you say, oh, I'm depressed, like, okay, you can be blue, sad, down, hopeless, right? In some ways, or you can be feeling actively suicidal, right? So there's a range, there's a big range here. And so BDD, yes, there's a preoccupation with appearance, but it also comes back down to how a person views themselves, right? Like, how are they judging themselves? Are they comparing themselves to maybe themselves when they were 10 years younger, right? Are they comparing themselves to, are they comparing themselves to a neighbor, right? or somebody online, right? And are they finding their
Right.
flaws? Are they looking for flaws? Were they told that they have flaws and now maybe they've internalized those messages and it's become part of their narrative and their dialogue?
Gotcha. Yeah.
A lot of times we see kind of comorbidity with other disorders as well, right? So we know that kind of through the developmental course, the age of onset is usually, the mean age of onset is usually 16 to 17 years. So think of like late adolescence, early adulthood. And the most common age when it starts is 12 to 13.
Oh, terrible timing.
Yeah.
Yes,
Oh.
lots of moving parts
Yeah.
developmentally. 2/3 of individuals have disorder onset before age 18.
Mm.
So,
Wow.
and we know that subclinically, we know that symptoms in line with body dysmorphic disorder begin on average at an age of 12 to 13. So again, they usually evolve gradually over time before there's a full-blown diagnostic feature. But although some individuals
Right.
experience abrupt onset, the disorder typically appears to be chronic, low-lying, and then improvement is documented when treatment is received and when there is supportive psychotherapy. Sometimes there's medication management that's needed, but the prevalence here is that U.S. adults, right, in the USA, adults will suffer from BDD at about a 2.5% rate. Usually 2.5% in females and 2.2% in males. So we know that out of 100 people, right, 2.5 or 2 or 3 women, because we can't have a half of a female, but 2 or 3 women will have BDD to the extent that it reaches clinical threshold.
Oh, wow.
And also like dermatology patients, we know that people who are more inclined to seek services for dermatological issues have usually 9 to 15% of dermatology patients have it, and 7 to 8% of surgery patients have it. So cosmetic surgeries will promote that.
Right.
And a lot of oral or maxillofacial surgeries will also promote that at like 10% range. So there's a lot of moving parts here, and that we have to acknowledge as well.
And that's people that have been diagnosed, right? So theoretically, the number could be even higher for people that don't know about it.
Yep, absolutely. So that's basically like reaching clinical threshold. So again, if providers are not screening for it, or if maybe somebody who's going in for, a derm check or maybe, some form of procedure, they may not be sharing these concerns with their provider, or they may not have a safe space to talk about their internal world. And that goes unaddressed, right? And we know that the longer we wait, the more things fester and grow, and then it becomes really difficult to contain. So we know that there's a lot of shame. There's a lot of excessive focus. There's a lot of reluctancy to reveal concerns to other people. And there's a lot of times people who struggle and suffer in silence don't have the ability to say like, hey, I am struggling and I do need to talk about this, right? So I encourage, if you perhaps are listening to this podcast, I encourage you to reach out and reach out to a healthcare provider or somebody who's in the mental health industry. There's great resources online that I can provide as well at the end of the talk that I'd be more than happy to. But it's a very important topic to discuss. And again, let's reduce the stigma of pathologizing, right? This is within the human experience. And so many people struggle with all sorts of different stuff, that BDD is just part of that.
Yeah, for sure. I feel like a lot of people too are who might have BDD and it's undiagnosed are quick to say, oh, I'm just insecure. Or, oh, I just worry about my appearance too much. But they don't realize to the extent of it that it could be.
Yeah, because they think it's normal. That's all they know.
Right. Exactly.
Me being one of those in the past. So no judgment at all.
Yeah, exactly.
But knowing that, our perceptions of ourselves and our relationship with ourselves does change over time, especially if we're working on it, right? We can understand the the influences and the sources that have contributed to this relationship with ourselves.
Yes.
And through exploration and understanding comes change, right? As a human, we have the ability to change. And just understanding that even if you are struggling, right? I struggle with my own mental health issues as well. And we're not defined by that. We can carve a path forward, and we can have and build a different life for ourselves, and change that relationship. So it's not a forever stamp. It's not forever ingrained in your skin or in your persona. It's a very malleable, you can achieve full remission very, I'm not going to say very easily, but if you are working towards it and you are actively engaged, change will happen.
That's very encouraging.
And it doesn't always take as long as you think it would be. You know, sometimes a little goes a long way.
Right.
Mm-hmm.
Right.
Yeah.